we've got some pictures today. What are we looking at, Dr. Foulad? What are we looking at?
Okay, so I guess the theme today, we're going to talk about reducing the fullness under the chin. You know, if you have a double chin and you want to reduce some volume, and you know, the different techniques and approaches that we could do to achieve that natural result, but yet get tremendous changes, right, at the same time.
That's awesome.
And so this first photo is a liposuction patient where we did liposuction under the chin area, and we also did a little buccal fat reduction at the cheek, but we'll focus more on the neck area.
Okay.
And so when someone comes into the office, and
that's your office? That's great lighting, by the way.
Yes.
I want to come over there and we'll do a segment.
No.
All right, sorry, continue.
So I took my photography courses as well. You know?
Oh, there you go. I like
got all that set up.
Yeah, it's like flawless lighting.
I know, look at that lighting.
It's fantastic.
Okay, sorry. We're talking about his work. Sorry,
Right.
back to you.
Well, I'll take that compliment as well. So. So she comes into the office and she has fullness under the chin area and she wants to reduce that. So we could talk about things, you know, options are from minimally invasive to more invasive, and the goal is try to pick the least invasive thing that's going to give us a great result and it's going to keep it natural. And in her, and you know, so people will come in and they'll say, what about Kybella, cool sculpting, true sculpting, things like that. These are the very minimally invasive. You really are not doing anything too extensive in those cases, but in a neck like this where you have that much fullness, I don't think those are going to be sufficient enough. And so in my office, unless you just have a tiny little bit of fat under here, the most minimally invasive thing that I recommend is liposuction, and that's exactly what we did over here. And
she looks great.
And that's the transformation. That's her a few months later.
Wow, she looks great. She looks so full of confidence in the second photo. You can see it in her eyes that she's just beaming. And why is it that, like, I think Carrie Ann was telling me this, that like you can actually get fat under the chin not due to being overweight. There's like an actual, what is that?
Correct. So I mean, you could have a hereditary component in it too, when you're just born with just a little bit more fat in that area. And we're going to talk about these other things later with the next thing that I want to talk about, which is the central neck lift. But in addition to the fat, you could have big glands that are sagging down, the muscles, and you could have a whole lot of other things going on that need to be treated. In her case, she was very fortunate in that most of that fat was just under the skin, and that's the fat that liposuction could treat. And so it's not that everyone that walks into the office looking similar to her will achieve a result like that. We have to do an analysis and figure out, is liposuction going to be a good fit for you? Is it going to get you what you want? Now for her, we've had a dramatic impact. It still looks natural. It still kind of looks like herself. Just like you said, she looks more confident.
Yeah.
And that just kind of, it slims the face too a little bit. We did do a little bit of buccal fat, but it just overall improves the harmony of the face.
She looks beautiful and full of confidence. You can see it in her eyes. And move on to the next picture. What are we talking about here? What's this?
So here we've gone to a central neck lift. And
wow,
this is the next step above liposuction invasiveness in my office. And this is a big game changer. The central neck lift, you know, some people will call it a limited incision neck lift, different than a full neck lift in older patients where we're needing to lift and pull up the residual skin. In younger patients, we just have a small incision under the chin. It's a very small one, about an inch. And I do all of the work through there. And what's different between this and liposuction is that I could go into the deeper structures of the neck and contour those.
Wow.
So the deeper fat in the middle, some muscles that I could reduce over here, those are the digastrics, and then the submandibular glands. These are glands that make saliva. In some people, they're drooping down. And in her, when I saw her in the office, I palpated them, and she had very big glands. So we weren't going to get as much benefit as she desired with just the simple liposuction. So we went in and we did that central neck lift, but still, minimal incisions, just a small incision under the chin to achieve all of that and get that result.
Looks really natural.
It looks incredible. Let's move on to the next photo, shall we? Wow, look at that.
And those are my favorite views. I love that oblique view. It really shows you everything, and it's a nice view.
She looks gorgeous.